Hi everyone, this is Samantha Mins from the Nutritional Genomics Institute, and for today's GeneBite, I'm going to talk to you a little bit about oxalates. So oxalates are naturally occurring substances. They can be found in a variety of different plant foods, and what they do is they bind to calcium. Now, this happens within our bodies as well. So if an individual is consuming a very high oxalate diet, those oxalates are binding to calcium at a high rate. They're creating oxalate crystals, and then these crystals often accumulate within different tissues in the body. So depending upon where in the body these crystals accumulate, we can see a multitude of different symptoms. For example, we may see urinary symptoms such as UTIs, interstitial cystitis, or kidney stones. We may see musculoskeletal issues such as joint pain or fibromyalgia. We may even see neurological symptoms such as anxiety, depression, irritability, brain fog, and clumsiness. So oxalate intake can really affect many different systems within the body, and it may manifest differently depending upon the person. So what are some of the biggest offenders in terms of oxalate content? These are going to be your foods like berries, nuts, wheat, soy, spinach, sweet potato, celery, and even things like chia seeds, cinnamon, and cocoa are very high in oxalates. So what we do at NGI is that we use a point system to help patients identify which foods are lowest and highest in oxalates. And depending upon that patient's genetics, of course, their metabolomics, and their symptomology, we are able to assign them a point or a point range that we would like for them to stay within in terms of their oxalate intake. And of course, we slowly titrate them down to that point level so that we can avoid oxalate dumping, which is a whole new set of symptoms and issues. So if you have any questions or if you'd like to learn more about oxalates or oxalate sensitivity, please join NGI this Friday, January 24th at 12 p.m. Eastern. We are going to take a little bit of a deeper dive into the genetics of oxalate sensitivity, how we test for this and identify it, and how we work with patients to slowly decrease their oxalate intake. So again, that's this Friday, the 24th at 12 p.m. Eastern, and we look forward to seeing you then.